automated prompt that states music hold ended, and that is your cue that you are live and may begin speaking. And with that, have a wonderful call. You'll be live in 3, 2, 1.
Music hold ended.
Hello, my name is Dana Marie Kennedy, AARP Arizona State Director. I would like to welcome you to today's Teletown Hall about extreme heat, featuring guest speakers from the American Red Cross and the Arizona Department of Health Services. We will discuss how to prepare for and stay safe during extreme heat conditions, the health risks associated with high temperatures, and the resources available to help you and your loved ones stay cool, safe, and healthy. As Arizonans, we are very familiar with dangers posed by extreme heat. Every summer, temperatures surge, putting many at risk for heat-related illnesses. In recent years, heat waves have become more frequent and severe, making preparations even more critical. In Arizona, extreme heat is defined as a period of 2 or 3 days of high heat with temperatures of 90 degrees or higher. It's crucial to understand how extreme heat can affect your health. Today's discussion will cover resources and services available, how to recognize and prevent health-related illnesses, and what to do if you or someone you know is affected by the heat. We are pleased to have with us today Edgar Olivo, Regional Chief Executive Officer of the Arizona Red Cross for the Arizona and New Mexico region, who will discuss the preparedness-related services they provide throughout Arizona. Renowned for his dedication to economic prosperity and social economic equality, Edgar brings extensive experience from his roles serving government, business, and nonprofit sectors. His leadership is pivotal in strengthening community resilience across Arizona and New Mexico, especially in the face of the global climate crisis and the unique challenges it poses to his region. Since stepping into his role, Edgar has responded to significant disasters, including wildfires, tornadoes, home fires, and floods. His team's quick and effective actions have provided vital support to affected communities, ensuring they receive shelter, food, and medical assistance. Edgar is leading the American Red Cross with dedication and a vision for community resilience. Joining us as well is Dr. Eugene Levar, Chief Heat Officer for the Arizona Department of Health Services, who will share essential information on state efforts to combat extreme heat. Dr. Eugene Levar currently serves as Arizona's first Chief Heat Officer, appointed to his role in 2024. He oversees the implementation of Governor Hobbs' Extreme Heat Preparedness Plan. He began public health work at Arizona Department of Health Services in 2012 as an epidemiologist, assisting with the state efforts covering border health and unexplained deaths. Most recently, he was the Assistant Director of Public Health Preparedness, overseeing 6 critical public health bureaus. Dr. Levar is committed to public health preparedness and continues to shape policies and initiatives to safeguard the well-being of Arizona's residents. Before we turn it over to our panelists, I'd like to introduce Alex Huertas, Communications Director for AARP Arizona, who will explain how to ask questions during today's call. Alex.
Thank you, Dana. And just we'd like to welcome everybody, and in particular, thank our hosts for being here today and providing this vital information to all of our Arizona residents. And like I was telling you right before the conversation started, the Teletown Hall. We're towards the end of the summer heat, but now this week we're going to have temperatures above 110 degrees. So this is still very relevant. We've got to be on the lookout, and in particular lookout for our neighbors. So make sure that if you have a question for our experts, you want to share any experiences with extreme heat, press *3 on your telephone keypad to connect with an AARP staff member that will put you on the queue. We'll take your question and put you on the queue. So again, it's you do that by pressing *key on your telephone keypad. So with that, let's go back to Dana.
So let's get to our first speaker, Dr. Eugene Levar from the Arizona Department of Health Services, to hear more about the state's role in helping Arizonans during extreme heat. Dr. Levar.
Hello, everyone, and thank you so much for that kind introduction. I'm so happy to be here today and to be speaking with everyone, and I hope I'm able to provide some helpful information. As Chief Heat Officer, I oversee the implementation of Governor Hobbs' Extreme Heat Preparedness Plan. This will require collaborating and coordinating in partnership with the Governor's Office of Resiliency and engaging state agencies, local health departments, tribal communities, municipalities, academic institutions, and many other partners and stakeholders across the state so that we can be ready to deal with each heat season from year to year. One of our efforts includes outreach and information sharing, and I wanted to share some relevant information with everyone today. As mentioned, I think many of you have seen that we are expecting some elevated temperatures in Phoenix and the surrounding areas later this week. And we need to remember that even though we are in September, Arizona is still dealing with summer heat and high temperatures. We know certain populations are at greater risk to the effects of heat, such as older adults greater than 65 years of age, infants, young children, adolescents, those living with cognitive, mental, emotional, and physical disabilities, those experiencing homelessness or having trouble paying utility bills, the homebound, the physically ill, and those on certain medications that can include those with depression, insomnia, or poor circulation, those who work outdoors, which could include electrical line workers, construction workers, farm workers, and many others, individuals living with substance use disorder, and living in rural communities. But we cannot forget that everyone is at risk for heat-related illness and death. And heat-related illness occurs when the body becomes too hot and is no longer able to regulate its own temperature. Since heat-related illnesses can lead to death that are preventable, we need to look, see, and act when we recognize heat exhaustion and stroke. Heat exhaustion symptoms can include dizziness, thirst, heavy sweating, nausea, and weakness. We want to act fast and have that individual move to a cooler area, loosen their clothing, have them sip cool water, and be sure to seek medical help if they do not improve, because that can lead to heat stroke. And talking of heat stroke, we want to be sure that we can recognize those symptoms too, which can be a next phase of progression when you're exposed to heat. That can include confusion, throbbing headaches, changes in consciousness, seizures. If anybody that you see is experiencing that and out in the heat, we want to make sure that we act fast. And you want to make sure to call 911. If able, move that individual to a cooler area, loosen their clothing, and cool with water and ice. We want to be sure to do these steps because heat stroke can cause permanent injury or death. So remember to look, see, and act if you recognize any of these symptoms that were mentioned. As we navigate each heat season, a simple step we can take is to stay connected and check on your family, friends, and neighbors to ensure that they are doing well and help connect anyone in need to available resources in our state. There are a few immediate resources we want to be aware of each heat season. One of those is azhealth.gov/heat. This is a website that we have here at ADHS that can help you stay up to date on easily accessible information and resources. That can include a map to identify a statewide cooling center that could be close to your residence, state heat-related illness resources. You could sign up for excessive heat warnings. You could see toolkits that are available for various different communities, such as older adults, school-aged children, and those who work outdoors, and many other resources. It's a great place to go to and to stay up to date on the latest information that we have available within our state. Also want to mention 211, where you can find information and assistance about cooling center and hydration stations, heat relief weatherization programs, home relief weatherization programs, heat relief utility assistance, Arizona tenant rights and repair, and also how to recognize, prevent, and treat heat-related illnesses. And finally, we want to mention a resource that in a recent partnership that we have with Arizona Poison Control, who you can reach at 1-800-222-1222. At this number, individuals can reach someone 24/7 so that Arizonans can call and get information related to their medications and possible heat impacts and precautions that they should take related to this, as an easy way to get that information from a nice science-based factual line. As we work together each heat season, it's important that we prepare and that we're aware of how we can help ourselves and others during extreme heat. Let's not forget through September to stay safe and healthy, stay cool, stay informed, stay hydrated, be sun-wise while enjoying the great outdoors, and stay connected by checking on your family, friends, and neighbors throughout heat season. One of the things I want to mention is a system that's out there that you can help monitor and see what impacts may be going on related to extreme heat and what you're experiencing in your local areas. It's an item called heat risk, and I want to mention why it's so important. Heat risk is a tool used by the National Weather Service that gives 24-hour forecasts of how heat might affect people, and it uses a color and number system to show how dangerous heat could be based on the time of year, day and nighttime temperatures, and the duration of heat. It also uses the Center for Disease Control and Prevention's data to assess if those temperatures might increase the risk of heat-related issues. And for more information about these topics and the information covered here today, please be sure to visit, as mentioned, azhealth.gov/heat. Thank you.
Dana, you might be muted.
Sorry about that. Sorry for the delay. This is Dana Kennedy, State Director with AARP Arizona. If you do have a question, please press *3 on your telephone keypad to share your story or ask our guest speaker for advice, and an AARP staff person will go ahead and talk to you and see if they can help you. So now let's turn it over to our next speaker, Edgar Olivo from the American Red Cross, who will share critical steps about staying safe during extreme heat. Edgar Olivo from the American Red Cross.
Thank you, Dana. It's such a pleasure to be here. And as we heard from Dr. Levar, one of our favorite chief heat officers in the country and here in Arizona, extreme heat can be dangerous and is responsible for more deaths than any other natural hazard. Spending too much time or overdoing it in extreme heat makes it hard for our bodies to stay cool. And then when our bodies can't cool down enough, we can suffer from heat-related illness. Young children, older adults, individuals with chronic medical conditions such as a heart disease, individuals taking prescription medicines, outside workers, and those who live alone are more susceptible to the heat and are at greater risk of experiencing a heat-related illness. Other factors include obesity, poor circulation, sunburn, and dehydration. Extreme heat is dangerous. However, preparing and planning for extreme heat can protect our community. So let's talk about ways to stay safe during the extreme heat period. Create your own extreme heat preparedness plan and kit. You can ensure that you have enough water. You want to make sure that you have enough water stored during extreme heat events. For example, 1 gallon per person per day. And if possible, add drinks with electrolytes should anyone become dehydrated or begin experiencing signs of heat illness. Don't forget water for your friends, for your fur friends especially. 1 gallon per animal per day for house pets, as an example. If possible, consider using a refrigerator or ice to keep your drinks cool. Add instant ice packs or cloths that can be placed in cool water. If you don't have air conditioning, make sure your plan identifies places that you could go during the hottest time of the day. Some places to consider include pre-identified cooling centers, libraries, movie theaters, and malls. And if you do not own a form of transportation, plan for how you will get to a cool place. For example, you can call 211 for cooling center locations and transportation assistance. Your plan should also include what you will do and ways you can prepare for unexpected power outages. When extreme heat is expected or is occurring, make sure to stay informed by listening to local weather forecasts or your NOAA radio. But be aware of the extreme heat warnings and pay attention to recommendations from local authorities. If needed, be sure to get a weather radio with text display and a flashing alert to stay informed. You may also sign up in advance to receive emergency notifications from your local county emergency management. And we also recommend that you download the free Red Cross emergency app available on any device that also includes a first aid application as well. So during extreme heat, there are some simple steps you can take to stay safe. First, to keep cool, stay in air-conditioned areas as much as possible, and if necessary, go to air-conditioned public spaces or call 211 to find local heat relief shelters in your area. While electric fans or ceiling fans may provide comfort, they will not prevent heat-related illness when temperatures are above 90 degrees. So wear loose-fitting, lightweight, and light-colored clothing. Dark colors will absorb the heat of the sun. Take cool showers or baths. Avoid using your stove or oven. They'll create unnecessary heat in your home when possible. And never leave children, adults, or pets alone in vehicles for any amount of time, even with the windows cracked. Always check your back seat. The temperature inside a vehicle can rise 10 to 20 degrees in as little as 10 minutes, reaching dangerously high temperatures. It's also crucial to stay hydrated. Drink plenty of liquids, even if you don't feel thirsty. Avoid alcohol and drinks with high caffeine or sugar, as they reduce the body's ability to properly hydrate. Limiting outdoor activity will help lower your risk of a heat-related illness. So if possible, postpone outdoor activities. Otherwise, avoid the warmest hours of the day, usually between 11 a.m. and 2 p.m. If you must be outside, make sure you use sunscreen and wear a hat. If you must work in extreme heat, take frequent breaks and use the buddy system. Pay particular attention to signs of heat illness. It's also important to stay connected. Listen to the National Oceanic and Atmospheric Agency's weather radio for updates from the National Weather Service. Check on family, friends, and neighbors who do not have air conditioning, who spend much of their time alone, or who are more likely to be affected by the heat. This includes anyone under the age of 4 or over the age of 65 and individuals who have chronic illness. They may need your assistance, and check your animals frequently to ensure that they are not suffering from the heat as well. Finally, you must stay aware. As you heard today, heat-related illnesses can be extremely dangerous and require immediate attention. Most importantly, heat-related illnesses are preventable when steps to stay cool are taken. To review, there are 5 things you can do to stay safe during extreme heat. You can keep cool and never leave anyone alone in a parked vehicle. Stay hydrated and avoid alcohol and caffeine. Limit outdoor activity and avoid peak hours. Stay connected and avoid being alone. Check on your neighbors. And finally, stay aware and avoid overheating. If you have the time and resources, you can consider taking steps to help keep your home cooler during a heat wave by doing the following. Cover your windows with drapes or shades, particularly when the afternoon sun streams inside. Install weather stripping on your doors and windows. This will keep the hot air out and the cool air in. Use window reflectors, such as a cardboard covered with aluminum foil, to reflect the heat back outside. And if you don't have central air conditioning, install window air conditioners or standalone units. Be sure to insulate around window units so you don't lose any of the cool air. Call 211 for additional assistance for cooling. And as a final reminder, download the free Red Cross apps. We have 2. The emergency app, it is simple to use and lets you customize 40 different weather alerts with fast notifications. It provides step-by-step guides to help you prepare. Choose to use the app in English and Spanish with an easy-to-find language toggle and full weather alerts in both English and Spanish. The emergency app is accessible so people with disabilities can also use it. It's compatible with Apple Watch and Android wearable devices, so visit the App Store or text Get Emergency, all one word, Get Emergency, to 90999. Then we also have the First Aid app, and the First Aid app puts expert advice for common emergencies at your fingertips. Videos, interactive quizzes, and a simple step-by-step advice makes learning easy and engaging. You can access life-saving first aid content and locate your nearest hospital in case of an emergency. You can also select English or Spanish language in the app to toggle. Visit your app store or text Get First at 90999. Lastly, and most importantly, we challenge you to check on your neighbors. Communities that know their neighbors have proven to bounce back faster from disasters. This activity has saved lives during disaster situations and helped protect our community during extreme heat periods by checking on your neighbors. A quick check-in, phone call or text is the difference between their safety in the heat and a potential heat emergency. So knowing your neighbor is the first step to building personal and community resilience. And if you'd like to stay in touch, please visit redcross.org/AZNM or follow us on Instagram and Facebook, American Red Cross Arizona. Thank you to our partners at the Arizona Department of Health Services and our great sponsors and host, Dana, and the Arizona AARP.
Thank you, Edgar and Dr. LeVar. That information was extremely helpful, and I'm sure it will prompt questions from our listeners. Today, not just about staying cool, it's about staying hydrated, recognizing the signs of heat-related illnesses like heat cramps, exhaustion, and stroke, and knowing how to act quickly. Again, this is Dana Kennedy, State Director with AARP Arizona. If you have a question, please press *3. Again, if you have a question, please press *3, and an AARP staff person will put you through to our staff to be able to ask your question to our experts. If you've just joined us, again, this is Dana Kennedy, AARP State Director, and you're listening to a teletown hall with guest speakers from the Red Cross and Arizona Department of Health Services about extreme heat. Again, thank you, Dr. LeVar and Edgar, for those valuable insights. We would now like to ask you a polling question. So before we take your questions, we'd like to ask a quick question. Press 1 for yes and press 2 for no. Press 3 if you'd like more information. And the question is, before we take, do you know where the nearest cooling center is located? Again, do you know where the nearest cooling center is located? Press 1 for yes, press 2 for no, and press 3 if you'd like more information. Again, do you know where your nearest cooling center is located? Press 1 for yes, press 2 for no, and press 3 if you'd like more information. Thank you for participating in our poll. Now let's go ahead and take any questions. Alex, do we have any questions from our audience?
Dana, we don't have any questions. We have a quiet group today, and that's not typical of our AARP members. They're normally very active and asking questions, but I've got a couple of questions. Maybe Dr. LeVar, can you tell us, how long your position has been around? I know it's a position that was created recently. Can you tell us a little bit more why and how long it's been active?
Definitely. I'd be happy to. So this position was established after the release of Governor Hobbs' Extreme Heat Preparedness Plan on March 1st of 2024. I've been filling this position since the month of March. So it was really all hands on deck, getting into the weeds as soon as knowing that heat season was going to be starting in May. So it only had a little short bit of time to get going with efforts on that end that were going to be focused for our state. And the Extreme Heat Preparedness Plan really came out of a call of action from the community with the unprecedented heat and temperatures that we saw in 2023 and Governor Hobbs' emergency declaration that happened that year. And so all of this happened very quickly, where a lot of our state agencies, partners, and stakeholders came together to come up with this plan of action for our state so that we can go ahead and be in a better standing from year to year as we deal with heat season.
Thank you, Dr. LeVar. Just as a reminder, if you have a question for our experts, this is a great opportunity to ask a question about to our experts here. Press *3 on your telephone keypad. You will talk to one of our AARP staff members, and they'll put you on the queue. We still don't have any questions in here. And the second question that I have for you, either one of you, Edgar or Dr. LeVar, but we've seen instances of the elderly that possibly live in mobile homes where they're possibly not very well insulated. And when the temperatures get above 90, 95, 100 degrees, etc., that mobile home becomes a little oven. What recommendations, what resources can people look for in those instances where maybe they're struggling to pay their electric bill? Who do they work with? How do they work with the companies, electric companies, or what resources can they find?
I can start on that one if it's okay. Definitely know that utility costs are definitely something for consideration for all Arizonans across the state. If you are experiencing difficulty with your energy costs, utility bills during the summer months, there is a program by the name of Low Income Home Energy Assistance Program, and that is handled by the Arizona Department of Economic Security. There's a real simple, easy step that you can take to get in contact with persons that can help guide you on what you need to do to be able to receive assistance, and that is simply calling 211. If you're able to call 211, you can let them know that you're needing information and help with your utilities, and they can get you in contact with how to go ahead and pursue that low-income home energy assistance program, or LIHEAP, and if there's any other programs in your area that may be able to assist you with those utility costs.
That's great information. And I have a question. This is Dana Kennedy. And again, if any of our audience has any questions for our experts from the Arizona Department of Health Services or American Red Cross, please press *3. I hear a lot about cooling centers. And are these basically senior centers, or do we have additional cooling centers that has been part of Governor Hobbs' emergency declarance on heat-related problems?
Our state has been dealing with heat on a grassroots effort in an organized way, even since 2005. So our state has so much experience with standing up cooling centers, respite centers, and other ways to provide relief to vulnerable communities across the state. There are cooling center networks available in each one of our regions across the state, and we would recommend going to azhealth.gov/heat to be able to get to a map that can let you know where those cooling center locations are. And then there is also a effort that was within the extreme heat preparedness plan. Governor Hobbs came through and developed 18 mobile cooling units that could be distributed across the state to help vulnerable populations. And those are mobile cooling units. They're retrofitted shipping containers that are self-sufficient. They have solar power to them. Mini split HVAC systems that can provide a cool environment for those who just need a break from the heat. And those have been strategically placed with partners across the state this summer. And so that was part of one of the initiatives to just grow our cooling center network across the state. But we've also seen so many great initiatives happening on a community level. We've seen community step up, our community-based organizations, faith-based organizations to help expand our cooling network. The American Red Cross with their training on how to set up shelters and being there for communities that were in need and needing immediate assistance. And we even had examples such as the city of Phoenix starting their first 24/7 cooling center this summer, which was absolutely amazing to provide relief. And we've also seen expansion of cooling center hours happening across our communities. What we saw in 2023 and heard from the public, some cooling centers were closing at 2 o'clock or 3 o'clock. And these elevated temperatures may persist until 4, 5, or past that time. And so we saw a lot of cooling centers going and extending their hours for 2024. So many great efforts happening within the state of Arizona. Hopefully that helps a little bit.
That's great information. And Alex, do you want to go ahead and give the poll results before we wrap up our call?
Absolutely. So the question was, do you know where your nearest cooling center is located? We got 44% of the callers that said, yes, I know where it's located. And also 44% that said no. 12% said that I'd like to get more information. So that be happy to, on our website and also on our Facebook page, we'll update it with resources of where people can find their nearest cooling location. Interesting results, 44, 44, and 12%.
That's great information. And also, would either one of you like to expand on what people can learn about the 211 system? I know we talk about people calling 211 quite frequently. Is that a number that they could call to find out more information about where a cooling center is close to them?
Yes, I would add to this. Yes, the 211 number is the number to call. This entire summer, we were promoting that resource as the main resource for residents to call to find information for their nearest cooling center and to access free transportation for those who have trouble getting there. We know that sometimes people may already be experiencing a crisis when they call 211, and so there you can get a lot of preventative information to make sure that you are safe during the summer. So 211 is the number.
Great information. Again, call 211 if you need additional information, or also you can find out information about programs that would help support you to stay cool during these brutal summer heat temperatures. And before we conclude today's Teletown Hall, I'd like to give our speakers the opportunity to share any final remarks or tips for staying safe during extreme heat. Eugene, would you like to start out?
I'd be happy to. I think if there was anything that I want to express as just kind of a take-home message from today's call, I would just like everybody, to take away, everyone is at risk for heat-related illness. So it's important to know how to protect and prepare yourself, your family, your friends, and your neighbors as you move forward during each heat season. One of the things that we saw from the 990 reported heat-related deaths in our state is that nearly 70% of those were amongst Arizonans that lived in our state for 20 or more years. And so one of the things, even if you're a long-term Arizona resident, we can't be complacent when it comes to heat. And we often think that it's visitors or new arrivals that are going to succumb to heat-related illness and death. So we have to stay vigilant from year to year. The other piece is to look, see, and act, as we covered today, when it comes to heat-related illness and heat stroke. Be sure you know the signs and symptoms and what to do, and always have 911 available in case you see somebody in need. And finally, stay connected. Social connectivity can do so much for us in so many ways. And so we want to be sure that everybody out there is checking on your family, friends, and neighbors as we move forward through each heat season and beyond during any month as we go forward, just to make sure everybody is doing well. We can stay connected, we know who each other are, and help support each other from year to year. Thank you.
Thank you. And Edgar, would you like to give some closing remarks?
Yes, and thank you, Dr. Levar, for those tips. Great tips. Yes, over 70% of the heat-related deaths that happen in Maricopa County happen during an extreme heat warning, and so we know that information can help save lives. So planning ahead and staying informed is essential for extreme heat. In fact, when the weather alert goes off, I sometimes will text my neighbor, who I know are senior citizens, just to make sure that they're okay and that their AC is functioning. And so we invite everyone, download the free Red Cross emergency app. You'll get the alerts that come straight from the National Weather Service, and it's a way to be ready for any situation. And of course, if you do find someone in crisis, you can download the Red Cross First Aid app, and it's a tool that can help you help someone until help arrives. And so we want to encourage, again, as Dr. Levar had said, get to know your neighbors before a disaster event like extreme heat happens, and regularly check on them. It is a crucial first step for preparedness and community resilience.
Thank you so much, Dr. Levar and Edgar, for joining us today. You provided our listeners with great information, and we hope everyone will take action to protect themselves and their loved ones from the dangers of extreme heat. This is the first time AARP has joined with the American Red Cross, as well as the Arizona Department of Health Services, to address these heat-related illnesses. We think that it's really important, and we'll be doing this again. So remember, preparation is key to staying safe during extreme heat. Make sure you remember to call 211 if you need any resources. Thank you for joining us. Stay safe, Arizona, and this is the conclusion of this call. Thank you.